CLEAR and ACRES at Makerere University. Don't worry about the synonyms, you're just about to find out what they mean. And today, what we are talking about is rapidly responding to policy queries with evidence. We're going to look at some lessons that we can learn from the Rapid Response Service here in Uganda. So just putting it in context, in the current setting, in the face of COVID-19, decisions, policies, and laws have had to be made in real urgency. I think we'll all agree, policymakers and health managers, social systems managers are responding to old and new problems. But the problem is that they have to respond in a very limited time frame. They do not have the luxury of weeks and months to give direction in the clinical community or just the general governance of things. So sometimes these decisions have to be made in a matter of hours or days. Yet we still expect as high a standard as when they had months and years to make the decisions, because this is a matter of life and death, literally. A poor decision may result in as many deaths and sick lives as a good one taken a little too late. We have seen many examples of this. I'm sure I don't have to, bring them up. We have also seen that ignoring the evidence or using it inappropriately is equally detrimental. Yet this has been a time when there was a combination of, too much evidence on something, or maybe too many sources, partial evidence on another, too little time to sieve through it all, lots of barriers that government authorities and health managers have had to struggle with. Rapid response services are a strategy that aim to support policy and decision-making in such situations in urgent and emergency settings, with evidence that is of high quality, relevant, and most importantly, timely. We will hear about these, how they are structured and how they work with real examples from the policymaking process in Uganda. This is based on a chapter, chapter 8, I believe, of a book edited by Goldman and Pabari, who we are really glad to have as part of this webinar. And the chapter's author is also present, Dr. Ismael Kawooya, and two of his informants should be with us, Dr. Isaac Dumba and myself. So Dr. Ismael Kawooya is a research scientist at the Center for Rapid Evidence Synthesis at Makerere University in Uganda, where he has gained experience and expertise in health systems and policy analysis. He has worked with and researched on the Rapid Response Service to support decision makers at the national and subnational level with timely and relevant evidence that is used in policy and decision making. We'll hear a lot about his experience as we go through this. One of his informants, a user who should really give us the perspective from the user's side, is Dr. Dumba, who's the Assistant District Health Officer of Mukono District here in Uganda. Isaac has 10 years experience in public health and local health systems management, health systems and policy, of which 5 years he has spent as the Assistant District Health Officer in that state district. In this position, he is responsible for the delivery of several services, including maternal and child health and nursing services for the well-being of the district. He is very passionate and motivated about research, which is a great thing to find in a policy maker or a decision maker. And he also does a lot of mentorship and teaching. He's a part-time lecturer at the Department of Nursing in Makerere University. Mene Pabari has over 20 years experience in the natural resource management and sustainable development as an evaluator, as well as program manager and implementer. Between 2001 and 2004, she was responsible for monitoring and evaluation processes across a large scale of regional initiatives covering 12 countries in Eastern Africa. Following that, 2005 to 2009, she provided technical advisory services to environmental and agricultural programs in Eastern and Southern Africa. She is currently a visiting research fellow with CLEAR, Anglophone Africa, and the managing partner of Athari Advisory. We also have Dr. Goldman, who's an advisor on evaluation and evidence systems at CLEAR, Anglophone Africa. He's a former Deputy Director General in the Department of Planning, Monitoring and Evaluation in South Africa. Ian has worked for 40 years, probably more, on issues of rural development, decentralization, sustainable livelihoods, approaches, community-driven development, and evidence-based policy making and implementation, applying the disciplines of planning, evaluation, research, planning. He has worked in 20 countries in Africa, Europe, and Latin America, with national, provincial, and local governments, and in the NGO and SME sectors. Between 2011 and June 2018, he was the head of evaluation and research in South Africa's Department of Planning, Monitoring, and Evaluation, where he led the establishment of South Africa's national evaluation system. Ian left the DPME in July 2018 to join the Center for Learning on Evaluation and Results, CLEAR, based at the University of Wits in Johannesburg. And he's also doing a lot of advising internationally on evaluation and evidence, teaching and writing, and is leading a research project which has led to the book on which we are basing today's discussion. I will be sharing a few reflections, and my name is Rhona Mijumbi. I'm a health policy analyst and research scientist based at Makerere University in Uganda, and I'm the current director of the Center for Rapid Evidence Synthesis. I have a special interest in the use of evidence, in policy and decision-making processes, and I have been leading a team of researchers developing and evaluating rapid response mechanisms to support policy making in public systems. So after we piloted ours, we have been working with several others in different countries to see how this actually works and hopefully scale them up as much as we can. So I think we do have such a rich team, and I will not waste a lot of time. We need to hear from them. I will invite Ms. Mine Pabari to give us the background to the research or the book from which this work is taken. And then she will give us also an overview of the analytical framework that was used to guide the writing. Following that, we will hear from Dr. Ismael Kawooya, giving us an overview of what the service is like, what is this rapid response service that we're talking about, and to also give us a few case studies demonstrating its application. I hope Dr. Dumba has joined us. He's been in touch, but we hope he will join us. So that he can actually help us reflect on some of the lessons from a user's perspective. And then following that, we shall take some questions and reflections from the audience. The chat is being moderated actively, so feel free to communicate to us through it, including sending some questions for the Q&A session. So Mine, let's hear from Mine Pabari.
Thanks very much, Rhona. Do you mind sharing your screen?
No problem.
Hello, everyone. It's very nice to be here. I think we're now into our 5th webinar, and I see a few familiar faces, so it's great to see everyone here. Okay. Thanks. So as Rhona said, I'll just take a few moments just to walk you through the background to this particular case study. We can move to the next slide.
Is that, okay, just a minute, there we go.
I wonder if it would be, if you can put it on slideshow, would that be easier to see?
I'm sorry, but is it a slide ahead?
Yeah, it hasn't moved. The slide hasn't moved.
Okay, just only 2 seconds and it will be back.
Yeah. Okay, maybe as the slide is coming back up, this particular case study comes from a research project that we took 2018 and 2019, looking at different examples of the use of evidence across different African countries. I think one of the unique elements to highlight about this particular research is we were looking at evidence used from a demand perspective as opposed to a supply perspective. Yeah, so if we can go back a few slides.
I'm already sharing. Is it coming through?
Yes, it's coming through. Could you go to slide 2, please? I can also. Sorry, everyone. Rhona, shall I try sharing from my end?
Okay.
Oh, it's coming up.
It should be better now. Mina, is that okay?
Yeah, that's perfect. Okay, so sorry everyone. So as mentioned, the research, one of the important things to highlight about this research is we looked at evidence use from a demand perspective, so as opposed to a supply perspective. And in doing so, we involved policymakers as co-authors, which really was incredibly valuable in providing insights in terms of from the policy perspective, yeah, and really guiding us as we carried out the research. We looked at 8 cases from 6 countries, and I'll just show those to you momentarily, and looked at a variety of different types of evidence, from evaluations to rapid synthesis, which is what you will hear about today, also citizens' engagement and public participation. And we looked at evidence use and really zoomed in on what supported evidence use to happen. What were the enabling factors and those that hindered the use of evidence? This has all come out in a book that's been published. There's a link up there. I think we will try and share this with all of the participants. We're also sharing, okay, I understand it's being shared in a file, but we're also sharing the findings from the research through a series of videos. There's a video on each case study, and there's one on rapid response, which is really worth taking a look at after the webinar, perhaps, and a series of policy briefs as well. These are the case studies that have been used to inform, that were used to inform the research. We've got a couple from South Africa, as you can see up there, one from the Department of Basic Education, looking at the use of evaluations. One that really highlighted the significance and sort of the intricacies of multi-stakeholder processes, violence against women and children in South Africa. 2 from Uganda. There's the rapid response that you listened to today, and public procurement evaluation. Sorry. And then there's one from Benin, public participation in Kenya, sanitation services in Ghana. The 3 of these, Benin, Kenya, and Ghana, they also very much spoke to participatory processes and stakeholder engagement. And then lastly, the using evidence for tobacco control in West Africa was particularly interesting, as it was a regional case study that cut across a number of different countries. So on the analytical framework, all of the case studies were informed by a common analytical framework that built on 2 existing frameworks. One was the science of using science, and the second was the context matters framework. We use the framework not so much to speak to how evidence use should take place, but really to, because that would be very difficult to do as each context and circumstance is different, but instead to provide a more structured way of exploring evidence use, how it takes place and what are the different factors that influence it. Next slide, please. So this is the analytical framework. The evidence journey itself is on the inside, the multicolored boxes, and on the outside is context, driven by demand. So as I said earlier, our starting point was very much from a demand perspective. And then we looked at the influences, the contextual influences that had a bearing on how the evidence journey played out. As you see on the far right-hand end of the screen is development impact. So this deliberately sits slightly outside of the influence, as very often there's a significant leap between evidence, evidence use, and development impact. So I'll just walk you through the different pieces of the analytical framework, just so it makes a little bit more sense. The next slide, please. Okay, so framing all of this is really what many researchers in this field have acknowledged, that evidence use doesn't take place in a vacuum, and it is influenced by multiple factors, both those external and internal to the institution that's really shepherding or at the center of this journey. These include the broader, for example, the broader political and socio-economic environment. In the case of Kenya, for example, this was the timing or sort of the proximity to an election cycle, or legal requirements around legislative review. And internally, such as the organization of culture or the nature of leadership or the existence of evidence champions. So if you can just click, yes, thanks. So evidence generation obviously is a starting point. We didn't spend a lot of time on this. As I said, our focus was looking at the use processes. So these two, if you can click on both of them together, the use intervention and the change mechanism, this is coming from the science of using science framework. And essentially one of the core messages here is that evidence use doesn't take place automatically. It's really it is critical that a series of deliberate interventions are carried out to enable use, and interventions that are appropriate to the existing context and the wider environment. So these may include capacity building workshops or establishing structures such as steering committees, or knowledge brokering, or working with champions. And what the interventions do, very often in our thinking, we just stop at the interventions. But what the interventions do is what's important. They trigger changes that are then critical for use. And these include building awareness, or what was of great importance across all of the case studies was very much around agreement and trust building. Ultimately, we hope that the process leads to use. They then need to lead into and support organizational or individual or systems change. And here we looked at the COM framework, the model. So we looked at capability to use evidence, we looked at motivation to use evidence, and opportunity, and how the interventions and change mechanisms influence one or more of these factors. And actually in all of the case studies, it was a combination of all of these factors. Evidence use itself took place in a number of different ways. You had all, I think 7 out of 8 of our case studies, we saw instrumental use, where you saw tangible changes that took place to a policy or a procedure. But we also saw across a number of the cases, conceptual use, where you didn't necessarily have direct action, but a deeper understanding of a particular issue. Process use, benefits that arose as a result of the evidence journey itself, and symbolic use, where the evidence reinforced pre-existing views. We weren't able to really look at and bring out the impacts that took place, the development impacts, as I've already mentioned. There's a significant leap, and also there was a time element to this. Okay. And then I'll hand over now to Ismael. Thank you.
All right, thank you, Mina. So now I'm going to go through the experiences that we've had with the rapid response service. With this, I'm going to highlight 3 mini cases where we're going to try to show how evidence was used by the policymakers and how what kind of mechanisms were at play in each of those mini cases. And then lastly, one of the policymakers with us, as Rhona had mentioned earlier, Isaac Dumba, will give us his reflections from the demand side, what he thinks or what they view as very important information and how they look at evidence and why they use this particular kind of evidence. So when we're talking about the rapid response service, what is it that with the rapid response service that we're talking about? So basically, as had been mentioned earlier, or as many of you might have come across during this period of COVID, is that this is a platform and its main role is just to basically avail already synthesized evidence. And in this, we're looking at really the best available evidence to policymakers who are in demand, who are in need of evidence to make urgent decisions. And this urgent may be real or perceived. So in terms of best available evidence, this could be systematic reviews or local available evidence. And this can be looked at as in terms of the quality of it, looking at systematic reviews, if you're thinking about the hierarchy of evidence, that is if you're thinking about it that way, or in terms of quantity, making sure that all the available evidence on a particular topic is actually available, even that within the local jurisdiction of the policymaker. And in this, the rapid response service here at Makerere defines its time frame within 28 days of when the policymaker should, or when the policymaker thinks of making the decision. And this is really tailored to an urgent need of the policymaker. And we try as much as possible to clarify the question, work with the policymaker throughout the process for them to understand what we're doing, so that by the end of the process, they actually know the evidence that is going to be provided and what is it that it's answering. This is contextualized and put in a format that is accessible to the policymaker. And in this, we use simple language. And also the packaging of the format itself, it's friendly and accessible, gives the policymaker the ability to actually find the information that they need in a quick process. So this rapid response service here at Makerere, the model, we start with the policymaker, and well, before we start with the policymaker, we have a scope. And in this scope, we defined our scope here as financing or governance arrangements. And this could be different with the different services available. And it is still within 28 days, as you would see all rapid response services or all services that provide rapid reviews provide a time frame. So the policymaker comes to us with a question. We have a readily available team that is available at all the time to receive the policymaker's question and work with the policymaker in an iterative format, just to understand what the policymaker wants to know and what kind of question is it that they want to answer by the end. So when we're done clarifying the question, we will then go through the processes that you know that go through the systematic review processes. That is, we'll do the search strategy, we'll look for the literature, get the extract the literature, appraise it, contextualize it, and summarize it in a format that is in a user-friendly format for the policymaker. And this would really depend on the kind of policymaker that we are working with. So we try as much as possible to understand who our policymaker is. We then go ahead to send it to our reviewers. We have a review process, the internal review process, that is managed by a senior member of the team who has not been part of the process, but also we seek out external reviewers who are content experts, but also have knowledge about the politics or the politics of that kind of question that we are working with. After that is done, after the external review, we package it in a format that the policymaker will use and send it back to the policymaker. So briefly, that is what the rapid response model looks like. So now, talking about these 3 cases, we have 3 cases, of which one is at the national level and 2 at the district level. So the one at the national level is the mandatory food fortification regulation. So here we had a development partner, unlike in the rest of the cases where we have the actual policymaker coming to us. Here it was a development partner who was working on the food regulation, on the food fortification program for quite some time. This food fortification program began in 2008, and this was GAIN, for those who may know GAIN. And by the end of the period of the program, they were worried that all their work, all their successes are going to go to waste if nothing is done about if nothing is done on how they can sustain the program beyond the funding phase. So they came to the Rapid Response Service trying to understand how is it, or how can they work with the ministry and other stakeholders to sustain this food fortification program. And from the briefs that we provided, it led into the mandatory food fortification program through a number of steps that led to the regulation that is right now. So the other two cases, we have one at the district, and the first one is about community distribution of misoprostol. For those of you who might know misoprostol is a drug, first of all, that is known more for its bad effects. That is, it causes abortions, and it is very good as an abortion-inducing drug. So, however, in 2009, WHO issued a recommendation that misoprostol should be used in places where the recommended drug, that is oxytocin, is unavailable due to a number of reasons, like the cold chain, cost, availability of skilled birth attendants. So misoprostol should be given in such circumstances. However, because of its side effect, that is, when a local NGO known as Program for Accessible Health in Communication and Education PACE, Uganda, tried to pilot this in one of the districts. After their success in one other district, they went to Mukono district to try and pilot this to distribute it to the community by including it in a safe delivery kit. But there was a lot of pushback from the local health workers, and this prompted the district leadership to come to the Rapid Response Service, trying to understand what evidence is there about the optimal distribution of misoprostol and what are the potential adverse effects that they should know of, that they should be aware of, and that this would be used in the discussions within the team. The other case is about reducing the turnaround time for GeneXpert. GeneXpert is now a recommended test for TB because of its very high accuracy. And before that, we had a lot of questions about the sensitivity of the current tests at the time, which were as microscopy. GeneXpert was known to really reduce turnaround time, but because of its expenses, it had to be put at specific areas that have specific facilities that have high volume, and the peripheral facilities would then have to send their samples to that hub, which is the facility with the high volume. Because of that arrangement, there was a very high turnaround where a sample is taken to the hub and it takes a minimum of 2 weeks to more than 3 months before the results are brought back. And as such, the district had a lot of issues due to follow-up, loss to follow-up of potential TB cases, and of course, this makes it worse for the control of TB within the community. So, though the district had tried a number of quality improvement programs, they had not made any significant improvement in trying to reduce the turnaround time. So they came to us to try and find out what evidence is out there that they should think about in trying to strengthen the sputum specimen referral system. So looking at these three cases, we get to think about how is it that they were used how is it that they were used? How is that the evidence was used in each of these three cases? So taking how evidence is used, the three common ways how evidence is used, thinking about the instrumental use, where how when you provide the evidence to the policymaker, they take it as it is and it is directly incorporated within a policy. Conceptual use, it really forms and tries to frame the discussion of a particular policy that the evidence was sought for. And sometimes there is the symbolic use where you have evidence is used, but it is only going to support a predetermined position for the policymaker. So you find most of the time that we provide the rapid response service, it really informs discussions, immediate discussions, meetings. Though you may not see it, it's used immediately. There are certain situations where the use is quite glaring, and you can actually pick it out and show that the rapid response brief that you provided was used in this circumstance. And in these are one of the three cases that we have. So here we have instrumental use. For example, in instrumental use, one of the options that we provided was used directly to inform reducing the turnaround time. And here they implemented the GPRS printers. And in conceptual use, we found out that it actually clarified initial perspectives of the local health workers who are part of the district health team in their discussions to understand what Mr. Prosto is about, how can it be used in reducing postpartum hemorrhage, and how can they reduce its potential misuse. So it got them to have deeper discussions around that and see how can they better use such a drug. And in the other part of conceptual use was in the mandatory food fortification, where it started the discussions that led to the mandatory food fortification regulation. And in the mechanisms here, because of the nature of the rapid response, it avails the evidence in a format that is accessible. It's in a simple language. The policymaker can easily pick out the key points, the policy options that they can take. It also encourages dialogue and interaction during the clarification process, but also where after that, there is a continuous dialogue to find out how the evidence was used. Also, the other thing is that it is demand driven, so you'll find policymakers come directly to us and ask for evidence. And we try as much as possible to ensure that it's visible. And because of us being the rapid response service being within the university, it is viewed as a neutral and a credible service to provide this kind of evidence. So the contextual factors that we can think about here in how, in what can affect how evidence is used. We have levels of decision making. We've seen differences in how evidence is used at national and at subnational level. At national level, you have more discussions going on. It may start a small process. It may fit within a policy process that is going to take about 3 years or 2 years, and it just informs one meeting. Whereas at subnational level, it is going to be more impactful, where you're going to have direct implementation. For example, you have a policy, there are policy options offered, they're going to discuss the policy options, and they're going to implement one of them. Because of the demand from the politicians that is at the district, you find that the district technical team is more willing is more confident to actually come to us and ask for the evidence. But then also the other factors that we've come to learn about that are very helpful, things like relationships and trust between the knowledge brokers, that is the rapid response service here, and the users. Incentives for the users are also very important, because here we look at an example. If you give a policymaker the rapid response service and they implement an option out of it, and so it turns out that this option is very successful. For example, the gene expert example that I've just given, they were able to reduce the turnaround time dramatically from 2 weeks to less than, they were able to reduce the turnaround time from 2 weeks to less than 48 hours. it was very dramatic, and that recognition of the policymaker who brought that evidence, it would be a motivation for them to come back for more. You have attitude of users. For example, we have one of our users who is on here, Isaac. He has a very good attitude towards research. He's so much interested in research. He's involved in research generation. So his enthusiasm and his attitude towards research will draw him more to seek out this evidence, and that can work positively in the use of evidence. So the other factors that you may think about, especially when you think about the harm that it can cause. For example, if the evidence is perceived as an extra task, you may give it to a policymaker who views reading or even interpretation of evidence or even asking for it as an extra task for their decision-making process. If they're going to take a few hours or a few minutes to make a decision, now you're adding in this other process of asking for evidence, you're giving them extra work. Then issues to do with champions. Mine has mentioned this, champions within the policy decision-making space. Champions are very key and very important to try to push this evidence within the policy space. Also not to forget the availability of resources. Most times we think about availability of resources to just the resources of the researchers, of the knowledge broker to be able to synthesize the evidence, but also that of the policymaker to be able to get the evidence, understand it, but also access it. For example, things like internet access in our low and middle income settings are very important. You may want to send the brief to a policymaker who is in a remote village somewhere in Uganda, and your only access to them is by sending it by email. If you don't have access to that, it may be very difficult to send it to them, and they will definitely need a computer. So from the supplier's perspective, what we've seen is that credibility and ownership of the evidence, because it comes directly, the questions come from the policymaker. They're more willing to know what the evidence is about, but then they also trust us. They see us a neutral body that is in the university. Our visibility to them is very important, but also we've been able to craft out relationships and trust with the users of the evidence over a long period of time. And these relationships, some of them come up as a result of the quality work. Most of them come out as a result of the quality work that you provide. Some of them as a result of some users that you might know of before. So there are different ways how these relationships have been crafted. But over time, as you keep working with them and keep giving them evidence that is timely and is of quality, they're able to trust and keep coming back to you. But also, it is also important to note that one of the strategies that we always try to use here at the Rapid Response Service is to increase the awareness of the service or increase awareness of evidence-informed policymaking, being an advocacy for evidence to the policymakers. So we'll go out, invite policymakers to a training, go to their offices, talk to them about evidence use, talk to them about the advantages of using evidence and in what circumstances they can use it. And in these interactions, they're able to appreciate or they're able to understand the value that they can use, that they can put into evidence. Thank you. So our policymaker is around who give his reflections and lessons.
Okay, thank you very much, Dr. Ismael, for sharing this opportunity for me. And for our listeners, I'm Isaac Dumba. I'm the Deputy Health Officer for one of the districts in Uganda called Mukono District. So I'll give my points of policy reflection depending on what we've used policy for, and I'll take my views regarding how districts are implementing rapid response to our setting as well. Then I also highlight a few key cases which we think have been key issues which has turned out our performance as a district of Mukono as well. And one of the things which Dr. Ismael has hinted on was the gene expert issue. Before, as a district, we used to have turnaround time of getting gene expert close to 1 to 2 months. And I think patients who are TB positive would really need care immediately. So that was a gap in our setting. So we as a district, we had tried different opportunities and interventions, but they weren't working out at all. So what we had to do, we had to come to ACRES to help us come up with evidence which can help us to improve performance in that regard as well. And I think what evidence which was shared, it was, I think, 4 interventions, and we took one, which was using a gene expert printing and a GPS printing. And I think it has helped us in reducing the turnaround time, which was 1 to 2 months. Now it's close to 48 hours. And I think clients are happy, and they can able again get their results in time, and actually it can be initiated on TB in time as well. Then key things which we've learned so far, because there are different rapid response which we've tried to contact ACRES, and I think they are shared with us a lot. But I'll give my reflection on what have we learned so far as regards to sharing evidence with the district health team. One thing is actually we used a contextualized evidence. You know, they share with us evidence, but as a district, we come down to our governing body. We sit and discuss and see what is feasible in their own context. So that's what we use to really implement and see that if this works out, then we can go ahead and try to roll out to different parts of the country as well. So in that, it has helped us to improve rationalized decision making in our district Mukono. One thing which I still recall was the district health office. And the district health office had programs which are running in silos, and we couldn't meet as a district to come up with interventions which are working. So when ACRES shared with us different policy evidences, so all head of department would come as a team and bring upon their own challenges into how we can improve performance. And I think in that, it has helped us to work as a team and improve that cohesion which needed before and which was one there before. Then also, one thing which has helped us as well is even my front health workers at lower level facilities are able to use evidence in their while implementing their activities. And this has really helped me to keep abreast with what is happening down to the facilities as well. A nurse at a lower level facility can ask me a question, which in turn I raise it to ACRES, and ACRES can come up with a few different interventions which a nurse himself at lower level facility can implement at their own context. And in that, it has improved our performance in terms of targets, and also it has increased our finance base, because if there's an evidence which worked out somewhere, I can be able to sell it out to different partners in the district, and they can come up with funding opportunities to improve our performance as a district as well. Then also, lastly is the team cohesion, which is of late is existing, because everybody here, before a new partner comes on board with a new project, we need to find out that what they're going to work, what they're going to implement in our district is really evidence-based. So oftentimes we try to contact ACRES to come up with a different version of intervention in that area in which the partner is not implement, if it works or not. And if it doesn't work, we can be able to come up with the rational decision of not to accept a partner or to accept them to work in that view. And I think in that, Mukono district has really improved in each and every indices which we've partnered with ACRES. And I think even the different districts which we are in Uganda are trying to embrace evidence use in their own district planning, due to the fact that what we've done so far as a district of Mukono has really improved our indices as well. So those are key things which I had to share with you, so that you may understand. Probably if there are questions which you would want to ask, then I'll be able to take over the questions, please. Thank you very much.
Thank you so much. Thank you, Dr. Dumba, for giving us reflections that, oftentimes we say, we're doing this, we're doing the other, but it's difficult for us to put some sort of picture of what it actually means for the policymaker, for the end user. Is it changing anything in the systems? So to hear it from the perspective that you've given is very, very helpful. And thank you again also to Mine and Ismael for giving us highlights from the book and helping us to understand, you know, what is in the book, how did it come in there, why is it even important to think about it, but also giving us like real examples, you know, of what we're talking about here. I will turn this over to Ian, who has been moderating our chat room, but also looking out for hands that might be up so that he can take us through the question and answer session. So this, I'm turning over to you, our audience. You know, come and squeeze these people. Are they really saying, you know, things that's practical? Are they giving us stories, you know, coming from Disneyland? Everything sounds really nice. Let's ask them the real questions. What are the issues that we need to understand as an audience? So over to you, Ian.
Okay, so while we're still waiting for some questions, so while we're waiting, I've got a question for each of you, so to reflect on. So first of all, Ismael, what surprised you? I mean, you're familiar with the thing. So using the analytical framework, doing this research, what new did you find? How did the analytical framework help you to understand what was happening? And Isaac, I was fascinated to hear you mention frontline health workers are using evidence. How did you get that? What did you do to get that, the frontline health workers using evidence? And then Rhona, one for you. What about applying this model more widely across Africa? What about other sectors in Uganda, and how would you change it in other places depending on context? And then we have a question from Taku. So Taku, do you want to give your question?
Yes, thanks Ian, and thanks colleagues for presenting. It was insightful, but I'm just trying to think, why is it Africa is in the position it is right now in terms of underdevelopment? Of course, there are other issues that have led to that, issues of colonization and so on. But right now, given the fact that there are different sources of evidence, they've got their strengths and weaknesses, why at policy level would policymakers and implementers prefer evaluative evidence over other kind of sources of evidence? What is it that evaluation offers that would actually change the way Africa is right now? Because I think evaluation, in fact, should be able or should be in a position to change the lives of citizens and improve service delivery. Over.
Yeah, that's a big one. So maybe Rhona, you take that one from Taku, huh? So do you want to maybe while you're thinking that's a very big question. Isaac, do you want to just what surprised you? Let's just hear the answer to that, and then we'll look forward to some more questions.
Oh, okay. Thank you very much, Ian. Actually, I'll respond to your question. How did
yeah, sorry, I mean Ismael for that. Yes, Ismael, what surprised you in the research?
Good question. What surprised me in the research? With the analytical framework, you get to think about the whole, can I say, ecosystem, for lack of a better word, of the evidence itself, the journey of the evidence, not just from the point of the supplier, but looking at it from, you've generated it, it's gone to the policymaker. What is it that gets the policymaker to actually think about the evidence that you provided? But not just that, looking at the different mechanisms of the use, there are certain things that I had not thought about initially, like what made the policymaker come to you in the first place? What is it that come and ask for that evidence? Because, well, they got to know about you. We made ourselves visible to them. we trained them, we've built relationships, but also in their context, in their environment, what is it that can affect how the evidence is eventually used. So so in short, it's just that the analytical framework just got me to reflect at a deeper level in how evidence is used by the policymakers. But because of the nature of the rapid response service, I've been used to getting a question, you need it within 2 weeks, work with the policymaker within 2 weeks, give it back to the policymaker, and within a week, you know the meeting has happened and you have an output. You actually know how the evidence was used. So some of that had been more of like an automated process, not thinking about it at a deeper level.
Okay, so maybe Rhona, do you want to respond to Taku's question? Really difficult one.
Taku, anyway, we'll meet somewhere else and, probably have a longer conversation, because this is a question that probably goes way beyond a 1-minute answer. It's difficult to say, or not difficult, but, just to say why Africa is where it is, is a combination of so many things. But when we concentrate, say, on evaluation or evaluative evidence, and the question that you asked, why or what evaluative evidence can actually offer, when I think about decision making, when I think about interventions, think about budgets and how we allocate them. Evaluation basically provides systematic methods. If you're trying to study a program and understand it, you're trying to study practices. You're trying to make decisions of interventions, think about any decision that a policymaker might want to make a difference in their jurisdiction. Evaluation or evaluative evidence will give them a systematic way of understanding where they have been, and then a systematic way of planning where they are going, and also how they actually will get there, but how they will even know that they've actually gotten there. So evaluations help determine what works well. You look back and say, this is what we've been doing, this is how much we've been spending, this is what worked, this didn't actually work. We could improve here in a program or initiative. They help to demonstrate impact. So I believe that for a person who makes decisions, evaluative evidence is almost inevitable. You need it. Otherwise, you're walking in the dark. If you don't know where you have been, what happened, you have not found out what worked and what didn't work, and all you're doing is, we did this last year, let's do it again. You're practically walking in the dark. You don't know what's changed, and so you're not even allocating, your resources appropriately. So I believe that this is one of the problems that we have, to answer the question about, the problems in Africa. It's definitely more than this, but this is definitely one of the things. A lot of evaluative evidence has not been put to use, because the other thing is evaluations are done to actually be used. You want to use that information, but many times we've actually done, monitoring and evaluation as a, something to tick off the box and not use the evidence. If we were to use that evidence a little more than we do, I believe it would make a very, very big difference, because we would not repeat some of the mistakes that we have done, but we would also know the gaps that we need to keep filling, which gaps change each time we actually intervene. And I believe that a lot of this is not being done, and if we did, would make a big difference. Ian probably might have something in addition to that as well, having been, leading a program in the DPME. Would you agree, Ian?
No, I agree with you that I think it's evaluation provides that systematic example, analysis of what's happening and a direction for going there. But in the end, a lot comes back to the culture of decision making and the political culture and the bureaucratic culture as to how much that's used or not. But maybe let's come back to, so Melody's asked a very similar question. Mark, I notice your question, but Melody's asked a very similar question, Isaac, to the one I raised, which is how did you manage to build the culture of evidence use among your staff? And how are you supported from the central level to continue the generation and use of evidence? So it's very interesting to hear about what you're managing to do on the ground. We typically don't think of evidence as you know, what people at the front line necessarily do. We're thinking about the decision makers higher up in the system. So it's a fascinating example.
Yeah, thank you very much, Ian. Actually, one key thing which we need to appreciate is the fact that there's what we call bottom-up planning from facility level up to district level. So healthcare manager at facility level often come up with their own plans, which address their own needs at facility level point of view. But at times they used to include or recycle interventions which were not working at different years. So what you have to come up with them is actually after getting trainings from ACRES, then you have to come and make meetings at different health sub-district level to tell them that this is not working. We need to rethink outside box. We need to come up with evidence which can help us to address your own problem or challenges at facility level. So, and actually in that, they are different. Actually, most of the problems or the issues which have been raised to ACRES often arise from a facility level because they know that they have tried different interventions that are not working. So what can work out is if they can try to help us come up with different interventions in different countries which has helped to work, then they can please, you know, try it out. And two, we have a culture of sharing knowledge and keep merging issues in our own district health teams, and all of them are eager to learn more, because we have what we call result-based financing as part of the the modalities of financing in the district. And if you don't yield results, you can't be funded or reimbursed. So at times, facilities often have to look up to new innovations which can help them to hype their outputs or targets, so that they can be able to perform and supersede their own targets and get reimbursed at the end of the year or at the end of the quarter. So in that culture, we often try to share what works out or what can help us to improve our own indicators or targets right from the facility level up to the district level. So how has the government tried to help us in the culture of planning? Uganda operates in what we call a decentralized system of, and I think our government is more at lower level government. If our council or district council approves what we're doing, I think we are good to go. However much we are under Ministry of Health guidelines. So what we do or what interventions are shared with us must be in line with what the policy guidelines is saying, so that it can be able to implement at lower level. So key things to note here is facilities needs results, which at the end of it will be reimbursed or paid at it. Then second, we have a team which keeps on requesting for new interventions so that they may improve or hype their targets at the end of the year. Thank you.
Thanks. Okay, so I mean, I think there's stuff to explore there, but there's a question from Mine there around the effectiveness of training and what approaches you find work best to build capabilities and motivation for evidence use. I don't know, Rhona, you answer or Ismael answer.
Yes, let me take that, and I'm happy for Ismael or anybody in the audience who's had experience with this to add to what I say. I think that many models of training that we have used in the past, and we does not mean ACRES alone, but many models have actually based on a one-off training, which I think hardly works, especially for something like the rapid response service or evidence-informed policymaking, evidence use, evaluations. Many people are coming into contact with some of the concepts and information for the first time when you actually do the training. So we kind of keep a log for our trainers and trainees, that we take the first training to be, can I say sensitization? Like you're just getting to hear about something, you know, there's no big deal, there's no pressure for you to understand anything or to go back and practice next day or that sort of thing, that model, which assumes that when I hear today, tomorrow I'll practice. So our first training is really, you know, touch-based, and it actually means nothing. It even is also taken as a stimulation for interest, because many people, a lot of this work, when you get to understand it a little more, is very dependent on a person cultivating interest and being very committed to it. And so this is a point where they sort of hear about something and maybe they want to hear more. At the second training is when we now begin to think this is a little serious. The person actually got back, they've had these concepts before, they've probably gone back and, you know, read up on some of them, we've given them resources to take a look. So then the real training starts at that point. And then we might have a third, before a person can actually qualify for a training of trainers, where we actually think this person can walk back into the district and train their team about doing this work. They can go back to their country and do exactly this. So a series of trainings, repeating. So it's not even like they're building on each other. They're just sort of talking about the same thing, but going deeper and deeper. And then following that, we don't let them go. There's mentorship to ensure they complete a task or they go through a process and that sort of thing. And at any one point, if you walk into our office in Makerere University, you will find a person who's embedded, you know, with us. So they'll spend time with us. So we've had colleagues come from other countries, Ethiopia, Burkina Faso, all sorts of places, and they come and spend a few weeks with us, I think a minimum of 2 or 3 weeks, just seeing exactly how this works in real life, you know? So that training is away from the models that we have always known. And all of these we have kind of learned on the job, what it is that works and what it is that doesn't work. And this applies both for researchers like ourselves and knowledge brokers, but also for the evidence users. They go through a process that is not just a one-off.
Mine, do you want to just follow that up, even verbally, I mean, with voice?
No, just to say thank you. Thank you. That was really quite helpful, because we've engaged, we've come across this response on quite a few occasions. You know, how do you build a policymaker's interest and level of understanding in evidence use sufficient to actually then generate demand? So I think the, you know, the emphasis on really investing time and energy in an individual as well as an institution is really important, and is a message that needs to go out quite widely. Thank you, Rhona.
Yes, and in fact, Rhona and I have taught directors in Uganda, and this is part of a process of trying to get senior managers to understand why it's important, because if they recognize it and they see it as important, then, you know, hopefully there can be knock-on effects. I don't know, Rhona, did you see any follow-up from that course where you could see that there were benefits from it?
Yes. So Ian, the capacity that we built with yourself and others, I think we did this in 2018, and you know, with the Office of the Prime Minister as well. And my understanding is that the Office of the Prime Minister continued to engage these people even after that huge training that we did. Last year, 2019, we continued the mentorships and the trainings, just like I have explained, in some of the departments, in some of the ministries, say the Ministry of Gender, Labor and Social Development, and the Ministry of Education. And then earlier this year, in February, we had an evaluation of both the process that got them where they are now, and then the particular impacts. And yes, I can confirm what I was saying earlier, that the places where we had actually continued to engage with them and hold their hand and understand what it is they're grappling with and walk them through any problems, you could see that they had gained quite a bit. They were all able to give an example where they have already started to apply this. And yet that application did not come almost immediately after the other training. A lot of the applications have even come much later, but they're in a more comfortable place. They are more confident. They are leading others. And so that continued engagement has actually been helpful.
So Mark, you've been trying to ask a question for some time, and then James has also got one on the training side. So do you want to raise your question, Mark?
Yes, my question actually now is more a comment because it has been addressed now by several participants. So I just wanted to agree with you mentioning earlier, Ian, that of course evidence use needs probably more a culture change drastically, and also perhaps the breaking down of bureaucratic systems so that we can use evidence more widely. As we, in DPME, as we found that there were so many evaluations we did when we were there, with you, of course, leading, and so many improvement plans were implemented, which definitely showed that evidence was not being taken seriously in government anyway. That's all I wanted to actually comment on.
Okay, so James, you've got another thing about on the training side. Do you want to give your question? Yeah.
Sure, I'll be quick, Ian. Thanks for the invite. This is quite interesting. And Rhona, good to meet you as well. I think what we've been trying out, Ian, is to link kind of new technology to the certification. Let's make it simple. So it's a bit of an external incentive. I know that's not ideal. You want policymakers to internalize this and buy into it, but a little external incentive is not a bad thing. And so what we've tried through this is to make available using new technology, using the blockchain technology, a credential that is authenticated. It links the product of the work or the training to the individual in a way that cannot be broken. So it's a very nice thing. That it's a simple QR code or a link they put on their CV or the email. When you click on it, you immediately see the training provider and you see what they did. And it gives a real-time authentication, even if it's not a formal qualification. So I just thought it might be a nice idea, a nice add-on. But I take the point that firstly, they need to understand and internalize this, but a little bit of external incentive is not a bad thing. Thanks, Ian.
And so Liziwe is asking about the how to incentivize people to use the evidence. Any more reflections? So I think it's sort of addressed to Isaac, but I think it's equally applicable to the others. Then Isaac, do you want to start?
Actually, let me just give my thoughts, then other people come in, Ismael and Rhona as well. One, the incentive which often comes in our regard as a district perspective is the improvement in our performance. That's the first incentive, because our targets are improving. If I get evidence and I see that take for instance that the turnaround time of Guinea part is decreasing and patients are getting results in time, for us that's a plus. That's an incentive. That's an achievement out of it. And also I've seen different health workers trying to say that actually what evidence has helped them is to improve their performance at their individual health facilities. To me, that's one of the first incentive which I would really talk about as a motivator to uptake evidence used in our district as well. Probably Rhona and Ismael have other insights to give as well.
Does anybody, Ismael or Rhona, do you want to add something to that?
All right, I'll just add something small to that. So, well, the other incentives we can think about is the timely nature that the rapid response offers. Being able to provide this response to the policymaker within the time that they're saying a decision is going to be made could be a very good incentive for many of them to give them the confidence to go into a meeting, to go into a discussion, to empower them to discuss things and talk about different aspects of the policy or the decision that they're going to take. Something that we noticed that before, by the time they come, they're unsure about what they're going to do. Their confidence is a little down compared to what happens when we provided them with the evidence. But also it is something Isaac has pointed out when the evidence is of quality, it is also very helpful that it is of quality and they understand it, to be able to break it down in a language that is very simple for them is just another incentive for them. Breaking down those p-values, because you give a policymaker your p-values, they're not going to understand anything. Your scientific jargon, they will not understand it, anything, but also putting it out there to them that these are the key policy options that you can think about immediately, right from the format that we use, so that when they read, they're able to see this right off, and they're able to, even if you've provided this evidence in a very short period, before they have the discussion, they're able to get that very quickly and go on to have their discussions with more confidence.
So we're getting towards the end, and I think we probably need to close off. We've been going an hour and a quarter. So I wonder, Rhona, whether in you doing your closing, to just also say, you know, how you see this model. I mean, you are working with other African countries. How you see this model being relevant to other African countries, and what's easy to apply and what's not so easy to apply. And then maybe you could conclude with that.
Sure, thank you, Ian. I'll give a few reflections. I'm also aware of a question you had directed to me earlier that I did not answer, so I'll try and answer that in my reflections here. So I'm thinking about this in the context that we are all kind of aware of now. But basically, when you think about rapid response services and everything that we've had today, and the way that we are defining them here, I'm aware that there are other services or platforms that try to do what we are describing. But when you think about them and how we are defining them here, this kind of work was first piloted in a low and middle income country 10 years ago. And their necessity and applicability, although that had been challenged about a year or two before that work, their necessity and applicability was overwhelming, clearly. It was overwhelming right away. However, academic peers like ourselves were quite skeptical. They were comparing these to academic evidence synthesis with no context of how policies and decisions are actually made. You have to actually walk in the in the shoes of a policymaker to actually understand that as academics, we totally forget, or we are totally ignorant of what they have to go through to make a decision on a day-to-day basis. So a lot of the skepticism was coming from that sort of comparison. Today, the usefulness of these services has become clearer, even to the staunchest of academics, I hope. The usefulness of these, became clear a few years ago when some of our partners in West Africa were facing the Ebola epidemic. And now, during the COVID pandemic, many have not had a chance to rest over the last few months, just trying to weave through the evidence and help policymaking and decision-making. The context is also better understood, that evidence goes beyond research. As academics, we've always thought that evidence is the research, which we see as rigorous, but we have also come to understand that, a riot in the street might be better evidence than a systematic review full of p-values when it comes to policy making. So such evidence is taken into consideration on a rapid response service, evidence that is beyond research evidence, for contextualization of problems, options to address them, and implementation and evaluation considerations to ensure successful enactment and execution of decisions and policies. Now, with these services, and we will have had, I think Isaac emphasized it, I think every speaker has actually emphasized this, that contextualization actually matters. So although the initial services that we started in Uganda were based in the health sector and at the national level, and in this particular country, we have actually seen this being replicated in other sectors. So the education sector, the climate sector is beginning, labor and social development. We see this now beginning to replicate the kind of model and service that we're talking about. We've also been a part of processes where this has been replicated in other countries, and also different levels of governance. We've heard that we started at the national level and then went to the district level, but I've also seen in other countries where this is being done, say, at the provincial level or things like that. Now, it is extremely important to understand what the contextual issues are that would make it work differently in different jurisdictions, but also at different levels, the different levels of governance. For example, the politics, the kind of questions being answered, and I think Isaac and Ismael have alluded to this. Policy making versus implementation, what is happening at the national level is slightly different at the district level. So just understanding those differences, because you might just lift one model from the national level and try to apply this at the district level, and it actually won't work. So just understanding all of that is important. One also has to think about the factors that might affect the use of the service within their context, but we know some factors that would be applicable in almost every context. And we've documented this in some publications. So context in this case actually means setting, but it also means the timing or the times, among other things. For example, in the times of a pandemic, like we're talking about, the way our rapid response service has actually been executed during this time has had to take fear into consideration. It has had to take into consideration the fact that evidence is almost like what is on the market shelf. So what is out today is the evidence. Tomorrow, it might actually be very controversial. And is the policymaker going to keep trusting you if they say, what you gave me yesterday put me in trouble, So putting all of that, contextual things where times also change, We have seen countries attempting to reach the evidence, but using new ad hoc structures, and those that have had such services already established, there has been a clear difference. So where you have a rapid response service already going, and you know the modalities of how it works, how you use it as a user, because they actually also go through a process of just understanding how to make use of such a platform. The language, the way they ask questions to actually be able to benefit, they go through a whole process. So now imagine if they're trying to understand that at a time when they're trying to make decisions as well. The pressure is so high that I don't know if they would even take the time to try and understand what it is they need to put in place for them to make use of such a service. So having this already in place is actually extremely important for decision makers. And we have actually seen it with many of our partners. We also talked about trust issues. You can imagine that somebody is getting to understand you now, and they've got to build trust to be able to take the evidence that you're giving them. And then, the pressure is already on. So we know that such issues are very important. So issues that affect uptake of such services, one, the design of the service. Have you designed this in a way that people are actually able to access it? Forget about accessing the evidence, but accessing a service that is supposed to be of help. I'm sure many of you have called customer care service, say on your phone provider. And then they say, oh, thank you so much for calling. Your call is important to us. Stay on the line. Then they'll put this music that lasts 20 minutes before you can actually get to the next step. You're not even talking to the person yet, just the next step. So if your design is such that it's so difficult to access the service, it's going to affect its uptake. Now imagine, again, put it in the context of COVID again. Can they actually access you as a knowledge broker or a knowledge brokerage platform? How about the resources that are available? This is really resource intensive. And I'm not even talking about monies alone, but human resource, time, lots of things. We're now living in the age where everything is now going digital, you're on the net. Can you sustain that, So resources should be adequate, but sustainable as well. It's useless for you to provide a service that is able to provide things for only 2 weeks. And then after that, after people are beginning to see the benefit, you cannot sustain it anymore. So you've got to think about the resources that you have available. How about the services visibility? Is it visible to the people who don't need it? And then those who need it, don't even know where to find you or how to find you. Then, most important, we have talked about, relationships and all, but the perceived integrity. the perceived integrity of this service and the evidence that you are providing. This is very, very important because some of these decisions, again, they are a matter of life and death, you know? So the integrity that comes with this, for people to actually trust and come back to you, is really important. But then, of course, there's some factors that you really don't have you know, control over. When you think about most of the environmental factors that we work in, the political will, and we have seen this, you know, in the COVID pandemic, the will to actually make decisions, you know, based on the evidence, the will to actually use the evidence appropriately and not cherry pick it, you know. Political will is really important, but also the decision-making structure. I think, like Ian pointed out, you know, when we're talking about how important evaluations are, how the decision-making structure is in the particular jurisdiction is really important to determine whether evidence will get used at the end of the day or not. Now, like Ian alluded to, there's been a whole lot of work going on trying to scale up, you know, the kind of issues we're talking about, or the kind of platform that we're talking about. I can give many examples, but I'll point out a partnership that's continuing to develop and evaluate these methods. You might have heard of a partnership called PALS, but now called Rapid and Responsive Evidence Partnership, REP. That has a number of partners in 11 countries in Sub-Saharan Africa, Latin America, China, in the Middle East, there's Lebanon. These are supported by the Hewlett Foundation and the IDRC, the International Development Research Center in Canada. And the partners are being supported to facilitate the use of evidence from policymakers and stakeholders in order to clarify development problems and causes, frame options to address them, and identify implementation considerations. So this particular study that's under PALS, so they're, you know, implementing things, but also studying to see how this actually works. And the project studies if and how the piloted mechanisms work and their effectiveness in actually facilitating the use of evidence by policymakers. I have not seen, you know, extremely busy people in the COVID pandemic, like what has been happening on the REP platform. This is a platform where they have just been bombarded by policymakers asking questions, trying to get evidence to be synthesized. And many of them have actually tried to meet those even under, you know, extremely difficult circumstances. We've all had to sort of try and understand how to work, you know, at home with little ones, but still deliver in a timely manner. This is when you're actually being asked questions that should be delivered within, say, 48 or 72 hours or things like that. But the program also explores if and how the strength of participating organizations, as well as their relationships with other organizations in each country's ecosystem of policy supporting organizations, actually increases over time. And that goes back to what we've been talking about, that these are contextual issues. How things were happening now will not be the same, you know, tomorrow or the other day. And so that has to be explored. How do things actually change within the ecosystem of making evidence? And there's a particular focus on whether the mechanisms used and their impact vary according to context or issues across countries. Can we actually say, you know, these platforms change when you begin to change a region? They change when you begin to change, you know, countries or things like that. Now, currently, our service in Uganda at ACRES, which was the subject of some of today's discussion, has grown exponentially since 10 years ago. We have 7 full-time positions and several persons working on short-term contracts, plus a pool of researchers and research scientists that are working or are based elsewhere, even out of the country, but, you know, within partnerships, who we can draw on as and when we actually need them. So especially in times like what we've been going through, the COVID pandemic, the pressure was high. 7 full-time positions are not enough, you know, you've got to have partnerships that you can draw on. So even if they're involved in the rapid response work, providing this evidence, they're also involved in a lot of research to improve the understanding around these and related mechanisms, so to build the field, you know. So then we're able to answer some of the questions, not so much from a theoretical point of view, but from a practical point of view. We have done it, we have seen it, we can answer confidently. they're also involved in building capacity. And I think I have shared a little bit on the model that we use. And this is for users and non-users alike. And so, you know, we carry out those trainings, we host interns, and we also host fellows from around the world who visit to see how this actually practically works. Where we want to go from now on, and where we hope that many of you can sort of join us in conversations, in critique, you know, we need a lot of critique to actually not live in this bubble of everything is working perfectly well, but to actually know the gaps that we need to take care of. What we're doing now is working on institutionalizing of the efforts that we have discussed. There have been enough pilots and experience, you know, to prove feasibility, necessity, and usability. Most of these have been fully funded by development partners. The concept now is to try and attract more government input. So when these development partners go away, is that, you know, is that it? We've been talking about resources being enough, but also sustainable, you know? So the concept now is to attract more government input, which is an ingredient we think is important for sustainability and institutionalization. We would also like to see the current efforts moved into models that do not threaten their existence and the benefits that we have already seen in them. So what business models actually work, knowing that the users, especially in a country like Uganda, in low-income countries, the users are under no particular obligation, you know, to use a platform like this or to refer to evidence. Many of them will probably get away with not using evidence. Even if it all came crashing, they'll still be minister the next day. So what business models can actually be sustainable, but also not threaten the existence of the work that we do and keep the benefits that we have seen? We're also encouraging other sectors, you know, to consider these models. So a lot of this has been in the health sector, education sector, and there are other sectors that have just not, you know, taken interest in this. So we're kind of encroaching on those sectors and encouraging them to consider the models that allow for the use of information and evidence in a timely and responsive manner. But for this to work, they actually need good and consistent generation. So you find that some of these sectors, even if they had, you know, the motivation to do this, they do not have the evidence being generated or information being indexed the way it's done very well, you know, in the health sector. So these are things that some of those sectors have to begin to consider and invest significantly in. So these are just some of the thoughts that I have, that even moving beyond COVID-19, we need to be ready for the next time there's this urgent global issue that we all have to deal with and have to depend on evidence. I think this is a time that we need to build the structures and the systems that allow for evidence to be used in an urgent or emergency situation, to be used relevantly, to, you know, have high quality evidence being used in a timely manner. Thank you, Ian.
So, thanks, Rhona. So, Rhona, will you just close off then? And I think we're ready for the end of this very, very productive session.
Okay, thank you so much, Ian. And then thank you to our presenters, Dr. Kawooya, Dr. Dumba. Mine, I hope you're still there. We haven't had your voice, you know, in a few minutes, but I hope that everybody has gained from this discussion. And this is a discussion that can continue even after this. We have some future webinars still based on the same book. So if you want to hear a little more about evidence use and real practical examples coming from the African continent, please do book in with the webinars that are flashing up on your screen. And please do join us again. We have had a very good time, and we hope that even those who were quiet had a good time as we did. Thank you so much. And I wish you all a nice evening, morning, afternoon, wherever you are.
Thank you, Rhona. Thank you, everyone.
Thanks, Rhona.
Okay, thank you, everyone. Bye-bye.
Thank you.